Got cut today, so that makes the dog nuts. She, for some reason, doesn't like the yard people.
You want to introduce yourself, Julie?
Sure. My name is Julie. I am the practice manager at the Arthritis Center on a satire channel here, right?
Yeah, it's all jokes.
All satire.
We're funny.
I'm also the bathroom monitor, but that's not satire. That is a real thing.
I'm C-Money636, otherwise known as Claudia, and I'm miscellaneous or her assistant, whatever works that day.
Yeah, yeah. I mean, bathroom monitor, it's a really important job.
Same with miscellaneous. Who's the
Yeah.
person you rely on at the end of the day?
Miscellaneous, or the dog. So I wanted to kind of give a little shout out to our friends at Meritain, which is an Aetna company. Can we do that?
Yeah,
Oh,
Aetna.
Ooh, Aetna. Okay, so this is super jacked up. They sent us this denial letter, okay?
Oh, I did put that on her desk today.
And this is a 33-year-old female patient who has severe worsening chronic conditions, okay? She's got 3 really bad conditions, rheumatology conditions that are worsening. These fools, okay, at Meritain, they want her to be on, are you ready for this? I will wait for people to get a pen to write this down. Meloxicam and Aleve. Listen, Aetna, Meritain, anybody that shows up in this office for rheumatology care is well beyond over-the-counter
Definitely
tomfoolery.
superseded aspirin, yeah.
Like, seriously, they want NSAIDs documentation. So Dr. Bach had to get out of an exam room, dictate a letter of medical necessity to Meritain Aetna to say this 33-year-old patient that has severe ankylosing spondylitis and enthitis does not need to try more over-the-counter medicines.
Meloxicam.
And she's already failed meloxicam and Aleve. Then, okay, you ready for this?
Right.
But wait, there's more. Then they want him to write 2 JAK inhibitors. People in the back, JAKs, J-A-K. JAK inhibitors are kind of dangerous drugs. There's 2 of them, Rinvoq and Xeljanz. Okay, there is a role for every drug in this office, but not for a 33-year-old patient that her shitty insurance, Meritain and Aetna, think that she needs to either go on meloxicam or Aleve over the counter or on the most dangerous black box warning drugs, Rinvoq or Xeljanz. Like, why can't we pick something in the middle, you morons?
Dr. Bach go up to the rep and say, awful drug, awful drug.
Like, he is not writing JAK inhibitors unless the patient is like old and been on everything else and the patient understands the significant risks involved in this. But wait, it gets better.
Oh, I love this.
Okay? So he writes this letter of medical necessity, and I emailed it and faxed it and uploaded it because, you know, a fax machine is like the thing in medicine. I don't know why. I emailed it to Margaret, okay, at AHHINC. Apparently that's another shell game that Aetna and Meritain are playing with. So that's who's in charge of the denial. And I write her this note and say, Margaret, your member keeps calling my office and our clinical team has had to increase her steroid exposure because of the continued algorithm denials. Aetna and Meritain, correct me if I'm wrong, but if you say Aleve or meloxicam over the counter versus, or Rinvoq or Xeljanz, which is the worst of the worst, dangerous black box warning. Like, seriously, what is wrong with you guys? What is wrong with you?
They don't have a doctorate in medicine.
Jesus Christ. Anyway, I said, I consider this an algorithm denial because it's so jacked up with a JAK inhibitor. Now we can do a trifecta.
I like that.
We can do a trifecta of health. You got your Meritain, you got your Aetna, and you got your JAK inhibitors. Or
Trifecta of health.
Or you can go to CVS
and not get Humira.
That, and you can get your Aleve. Anyway, so I'm like, Dr. Bach said he wanted to speak with one of their medical directors, or one of their medical directors could take over and write the JAK inhibitors on their license because he's not doing it on his. You ready for this? Margaret emails me back. Not really. Another algorithm denial. Thank you for your email. I'm currently out of the office and will return on Thursday, April 18th, 2024. If this issue cannot wait for my return, please contact Melissa at blah blah on Monday or Tuesday, and on Wednesday, please contact Kim. Like, seriously, is there anything else we can do?
Melissa's the biggest witch.
We can do for you guys? Like, we're here 5 days a week working, and you people have all of these redundant layers to
Oh my
deny
God.
patients. Like, this is not healthcare. This is not healthcare.
There's sickness and health.
Denial care.
That's good. That's
Okay.
good. I liked that.
All right.
Anyone in the back have questions?
Questions, comments, concerns.
I liked the paper tearing.
Well, I've had it.
I
I'm
took the witch
super,
comment
super
from you.
frustrated with these people because they are just smoking cigarettes and drinking probably regular Coke, not even Diet Coke. They're not really smoking cigarettes, but you know what I'm saying. I mean,
No,
maybe
hit
they
vapes.
are. I would be doing that if it was socially acceptable.
Well, you just sitting there denying. Just okay.
I don't even think they have to press
accept.
a button to deny. Like, it is so bad.
I've been trying to
So
explain
bad.
to people how insurance has literally inserted themselves into making medical decisions. Like, your doctor could come up with this treatment plan and they're going to be like, we think you should take some Tylenol.
Not even we think.
We know.
We want a physician.
And we're only going to pay for
We
it.
want a rheumatologist letter to say why a 33-year-old can't be on a JAK inhibitor or has already failed a leave. Now, people come in the back. This is a 33-year-old woman that had diagnosed rheumatology problems since she was in her teens. And these boneheads at Aetna think that she should be on the worst or over the counter.
Let's give you chronic kidney disease, stage 4.
I can't, I'm undone by this. And this poor little, but not little, this poor
Woman.
33-year-old woman, yeah, maybe she should take a risk on having all these dramatic cancers and take a risk on all these blood clots from the JAK inhibitors. And she's probably, childbearing age, 33. And so Aetna can just do whatever they want and put her on a JAK. Nope, not so much. Not happening.
What do they want? Methotrexate next? She's probably already
She's
exhausted
already failed.
it.
She's already failed methotrexate. She has a really
Complex.
now I ripped up her letter of medical necessity because I already faxed it
For
and
the
emailed
dramatic
it to
effect.
Mary. And
Insurance has gotten so bad. I don't know how they
Okay.
get away with it all.
here's what she's failed: gabapentin, leflutamine, methotrexate, sulfasalazine, and she needs relief from her worsening symptoms. Should a medical director from the denial team, that's you, Aetna, maintain,
Aetna
wish to
care.
discuss this case, I can be reached at blah, blah, blah. I have increased the patient's steroid exposure due to your continued denials. That's you.
What happens with increased steroid exposure?
Oh my God, the patient's like, first of all, they gain a shit ton of weight, which is no good. No one needs to be
a lot of
hurting
people
and
refuse
heavy.
to take it because of
Oh
the
my
weight
God,
gain.
but I mean, it's
You
a
have to take it
temporary
sometime.
measure.
Right.
It's a temporary measure to get through a flare. But this is beyond a flare. These people have been denying this since March 13th.
And
It's April 16th today.
it causes irreversible damage to your joints.
That's 2 months. That's 8 weeks that Aetna's been making it rain profits while they deny the people that are paying the premiums for care. And they say, no, not you, not so much you.
It's
not
almost
you
as
today.
good as the one letter we got, our patient sent us from their insurance company that said, if you are pregnant.
Okay, you know what? This is a really good one. So one of the Medicare Disadvantage plans that we showed the curb to, our last day in network with them, thank God, is May 5th. I know it's a Sunday.
We're a
I know.
rheumatology office.
We're a rheumatology office, and
We like
have a
Sundays.
Medicare Disadvantage plan that is horrid. This is a local one. Hi Debbie. She's the medical director. Okay, she has no control because what has happened is that some private equity or some other conglomerate has bought this Medicare Disadvantage
I
plan.
like that word.
Well, it's true.
Conglomerate.
It's true.
What's that mean?
Conglomerate? I don't know. Yeah, well, it means some big
Word of the day.
big oaf. You don't even know what an oaf is. It's just a big, stupid, unnecessary thing. That's a conglomerate. So that conglomerate has purchased them, and this medical director has literally no power to do anything. She doesn't even know what's going on at her plan anymore. At any rate, we terminated our contract in February, on February 5th, with a 90-day cancellation on termination as of 5/5/2024. Because they will not give us any relief on their prior authorizations. These, can you say MFs here? No, probably
These
not.
MFers.
Yes, these MFers, Dr. Debbie, I'm not going to say her last name, Z. Wow, maybe we could just
Ooh.
spelling bee. Anyway, did we just get a thing?
hangman. No, we didn't. No,
Oh.
that's fine.
Okay, at any rate.
She's used to getting written up, as you can see.
Yes. Insubordination is my middle name. At any rate, they refuse to give us any prior authorization relief. And
Or referrals from primary care
oh my God, it's
physicians.
such a nightmare. Such a nightmare. And 7 pages of questions for one patient to be on super inexpensive drug like methotrexate, which is an
Or
oral
prednisone.
medicine, or prednisone, or folic acid, or whatever it is. These people think they're so god-awful important that they need stuff to stamp their name on to deny or stamp their name on to approve. And we are just done with the bullshit. I'm just done with the bullshit. So, in our
She's
contract,
closer to her death than she is being born, is what
I
she
am.
told me.
Yeah, I am. And so listen, I'm going to go out screaming and yelling and fighting for patients. That's what I'm doing. That's what I'm doing every single day. So, they want us to provide continuity of care, okay, to some of these patients. They send us some BS level 3 continuity of care for a patient that's on infusions and no infusion J code, no administration code, no appropriate office code. They give us a level 3. You know what, Debbie? Do it your frickin' self.
Debbie, you know better.
You know better, and
Debbie,
you can't
you
do
know
a
damn well.
damn thing because it's all Jordan. He's got you by the balls, even though you don't have balls. At any rate, they had the audacity to send a letter to their patients, and here's what it says. Now remember, 95% of these patients are over 65, Medicare age. Dear Lucky Dog, they really didn't say that. If you are in the second or third trimester of your pregnancy, you can call us and ask for continuity care.
One of our infusion RNs go, what's the oldest pregnant person there's ever been? Because, mind you, you have to be 65 plus.
Well, you could be on disability, but usually they're not going to choose this
No,
insurance
this one
plan
is.
because this one's really for the old. The old,
Elderly.
yes, the very old and the very poor, okay? So anyway, how tone deaf is this insurance plan to send that? And they send it to male patients. If you are in the second or third trimester of your pregnancy, you can ask us for continuity care.
Talk about personalization.
This is healthcare. This is algorithm bullshit.
They can't even get our gender right or, you know, age, anything.
It doesn't matter.
It's
to them.
fine, though.
It's personal to us. So
And their patients.
That's the difference.
And their patients. God bless America. They're having to look for a new rheumatologist. And these people are just like, get a prior authorization to see Dr. Bach. Like,
That's what their staff is telling the patients. Have Dr.
Do you know what a
Bach send you
prior
prior authorization? What is wrong with you people? And you know what? I talked to a couple of them. They're all home-based workers. They don't have the energy or the time to tangle with this. I asked one of them if she wanted to fill out a COT, and she goes, "What's a COT?" I'm like, "Continuation of therapy." I would think
Well, we're
if you're
gonna
in
have
the
to get
insurance
approved.
business, you might know some basic shit.
but no.
No, no basic shit here.
No basic shit. It's all damn dumb.
All damn dumb. Yeah.
That's,
Yeah, it is.
that's to you, Debbie.
So that's kind of what we're doing right now, and it is 2:53.
We need to tell them about our conference. We did have fun.
Okay,
We
well,
met a
why
lot
don't
of
you talk to
people.
them about the conference? Tell them about the conference. It was really great.
Chris Deacon, like, touched my arm, like,
Okay.
we're best friends.
Claudia thinks that if someone touches her arms, they're best friends.
She
Chris
thinks-
Deacon is like a nationally renowned attorney
She's
in the
amazing.
healthcare space, and this one
Shut up.
thinks they're best friends. They're not. Chris is just like
Julie
super
had
gracious.
me ask her to dinner, and I was like, Julie, she's
That's
probably
true.
going to the airport. And she's like, just go try. I'm like Julie's special friend that will do whatever she says. So I'm like, okay, and I go up to her, and I'm
But
like,
wait, there's more to the story. She starts to run over to where Chris Deacon is sitting in the lobby, and she runs back and she goes, "Are we gonna pay for her dinner?" I'm like, "Yes, you fool. You think Dr. Bach is gonna say, 'Hey, Chris Deacon, you want to go to dinner? And by the way, bring
You're
your credit
buying."
card."
I was like, I just wanted to make sure I had all my bases covered.
The good news is she'll always ask, and that's great. And Chris Deacon did have to go to the airport, but not to worry. We had dinner, and the three of us ate for 4.
Oh yeah, it was so fun. We met authors of books that we're reading that look a lot
Authors
taller.
of books that we don't know the name of. How about Dr. Marty McCary?
I keep saying his name wrong.
McCrary. Why do I say his name? McCary.
Because I said it wrong.
I know. Anyway,
Ugh.
we got a picture with him. That was amazing.
The students and residents were a little mean to me there because I didn't know the difference between a resident and a student.
So the difference between a medical student and a resident is about 4 years.
Well, yeah, did you see how snotty they were to me? And then
Whatever.
Marty's like, hey, come on up here. And I'm like, guys.
Most people would call him Dr. McCary, but no,
Dr.
she's going to call him Marty. Hey, Marty, fist bump. We got a picture with him, so that's all that matters. Actually, he liked my tweet, too. Not a retweet, he liked it.
I mean, still, this woman got 2 retweets by Mark Cuban.
You know what? I think I just hit my mark at a really, really weak moment. I'll take it.
The one TikTok that I have that's gotten a lot of traction, people have tagged Mark Cuban and they're like, just give her a little bit of attention. Just like it. Nothing. He's playing hard to get.
You know, he can do that. He's Mark Cuban.
He pays his taxes, I saw.
276
$288 million.
No, he corrected that if you try to keep up.
Oh, shit.
His accountant got back to him. It's still a lot. I mean, can you imagine how much money you made if you're paying $276 million in taxes?
More than me, because I got 200 back.
I can't believe you even filed your taxes. Like, literally, I mean, I'm surprised.
Oh, some insurance denied my client's audio-only visit due to a policy that doesn't apply to provider and contract. Well, what we've learned is nothing really applies to the provider.
Right.
It's all between the patient and their insurance.
The contract is between the patient and their shitty insurance. And so one of the things that we're working on with a colleague is having the patients do the complaint directly, because that is going to blow them up and it's going to put a bunch of people on notice. We've got some friends over at the Department of Labor. Hi, Mary. Hi. Who's been amazing, and they're huge supporters of the patient, and they didn't think twice about coming down hard.
Oh.
Actually, I believe it was on Aetna Meritain.
It was.
Hi, Aetna.
They're like,
Meritain.
they said, we need all the records showing why you're denying it.
We want the
I need
recordings. We want all of it, and all of a sudden they're like, whoa.
We
Looks
approved
like we made a
them.
mistake. We're going to go ahead and approve this.
What are you talking about? It's been approved this whole time.
No, it has not been approved.
It hasn't, no. And then we actually got a denial, didn't we?
Yeah, I mean, you know, it's all in a day's work. But this one patient, I'm really excited. While we were in Oklahoma City, she started back infusing, and she had been denied by Aetna Meritain. I know you guys are on my shit list, but you can do better.
Aetna.
Give me a pathway to treat my patients.
Aetna
if
gives
you
the care.
guys, Aetna and Meritain, if you're out there listening to this nonsense, or if someone could forward it to someone in leadership, if you show us a pathway to care for your members, we wouldn't have to rag on you all the time.
Let us help your members. Let us help you.
This member had been denied and off therapy since July of 2023. It's April 16th. She started back on her therapy last Friday.
We have to just hope it doesn't take months for her body to start getting relief.
It's going to be what it's going to be. But you know what? It's on the backs of these people.
Man, I don't know how some of these people sleep at nighttime.
I think very well.
Well, yeah, on gold plates per Wendell, but...
Well, yes. Wendell Potter. There's another Chris Deacon Wendell Potter icon situation.
Oh, gosh. Man, fangirling. Chris Deacon actually said she could come on our podcast.
Okay, well, you better make that
happen. I know, I need to...
But she didn't give you her cell phone number.
We're not that close. It's like a famous person.
They're not that close.
Lil Wayne wouldn't give me his phone number either. Neither did those basketball stars I sat with.
Okay. Quick story. Dr. Bach, myself, and Claudia are boarding the plane. Dr. Bach and I are, I don't know what we were, C30, some way in the back on Southwest. We go all the way to the back. This fool, tell him what you did.
So I'm small. And I know I'm going to get middle seat regardless, so I always pick the first middle seat that I see. And it just so happened to be between two
giant basketball players. Giant. And it's on the bulkhead, okay? So
Jaden?
There's no place to put there's no place for your luggage underneath your seat because there's no seat underneath there. You're at the bulkhead. She walks on, and they both look at her and go, There's 35 open seats on this flight. And she goes, I know.
I'm sitting here. Sit right here.
Yeah. And the flight attendant comes by and she goes, ma'am, you're gonna have to get your suitcase up in the overhead bin. You don't have an under. It's all right. Here. I was never so glad to not be anywhere near her.
But this is why she brings me networking. Who would have thought? They actually
no, they hated you.
They loved me.
And here's the best part: they were staying at our hotel. Loved the Omni in Oklahoma City. Great vibe, great rooms, great bathroom.
I saw our bill.
Great food.
Who pays us? Paycom.
Paycom. They don't pay you. I pay you. We use their software.
I see it every day. Do
Yes.
you get embarrassed, Julie? All the time. She calls me a fool.
Our hotel was across the street from the basketball stadium, so I guess these basketball players were going there. And this fool sat between them.
We downloaded a Bible app to communicate.
Right. So, anyway, we're here.
Shayla wants to know if you ever get embarrassed by me.
I mean, you know what? I'm 59 years old. I've kind of run that gamut. Not really. If I get embarrassed by her, I just pretend like I don't even know who
Or she'll
she
be
is.
like,
I'm
"You
like,
fool."
security?
You fool. That's what I get the most. And whenever I thought that lady was Carmelita, and I was...
Oh my God. You know what?
We have too much, but...
You
Yeah.
are too much.
I am.
You are too much.
I am. But my dad said that's what makes me special.
Oh my God. Okay.
So,
yes, you are
happy
special.
Tuesday. And
God, it really feels later in the week, doesn't
It
it?
feels like a Thursday, yes.
Yeah. Is that my hair clip?
It is.
Why do you have my hair clip?
Well, I was
It's
looking
over
for
there
it.
on the desk.
Bonjour.
Oh my God. All right.
Bye.
Everyone.